Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Bladder cancer. Introduction. Bladder cancer is a common type of cancer. Of every 10,000 people, about 2 to 3 persons will develop bladder cancer. More than 9 out of 10 people with bladder cancer have a type called transitional cell cancer, also known as TCC. This program focuses on TCC of the bladder. Transitional cells line the inside of the bladder and help it stretch when the bladder is full and shrink when emptied. Bladder cancer is highly curable if found and treated early. This program will help you better understand what bladder cancer is and what treatment options are available. Anatomy of the bladder. Your bladder is part of the urinary tract. The urinary tract is made up of organs that make and release urine. Your bladder is a hollow organ in the lower abdomen. It stores urine, the liquid waste made by the kidneys. Urine passes from each kidney into the bladder through a long tube called a ureter. Urine leaves the bladder through a shorter tube called the urethra. The wall of the bladder has layers of tissue. These layers are known as the inner, middle, and outer layers. The inner layer of tissue is also called the lining. As your bladder fills up with urine, the transitional cells on the surface stretch. When you empty your bladder, these cells shrink. The middle layer is muscle tissue. When you empty your bladder, the muscle layer in the bladder wall squeezes the urine out of your body. The outer layer covers the bladder. It has fat, fibrous tissue, and blood vessels. Bladder cancer. The body is made up of very small cells. Normal cells in the body grow and die in a controlled way. Sometimes cells keep dividing and growing without normal controls, causing an abnormal growth called a tumor. If the tumor does not invade nearby tissues and body parts, it is called a benign tumor or non-cancerous growth. Benign tumors are usually not life-threatening. If the tumor invades nearby tissues and body parts, it is called a malignant tumor or cancer. Cancerous cells spread to different parts of the body through blood vessels and lymph channels. Lymph is a clear fluid produced by the body that drains waste from cells. It travels through special vessels and bean-shaped structures called lymph nodes. Cancer that spreads from one organ to other body parts is known as metastatic cancer. For instance, a cancerous tumor in the bladder may grow through the bladder's outer layer and nearby tissues over time. Cancers in the body are given names depending on where the cancer started. Cancer that begins in the bladder will always be called bladder cancer, even if it has spread to other places in the body.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Causes and risk factors. It is usually impossible to specify the cause of cancer in an individual patient, but we do know what causes cancer in general. Healthcare providers talk of factors that can increase the chances of getting cancer. These are known as risk factors. Smoking tobacco is the most important risk factor for bladder cancer. People who smoke for many years have a higher risk than non-smokers or those who smoke for a short time. For people with bladder cancer, quitting smoking may reduce the chance of getting other types of cancer, lung disease, or heart disease. Quitting smoking can also help cancer treatments work better. People with a family history of bladder cancer have a slightly increased risk of the disease. Some people have a higher risk of bladder cancer because of cancer-causing chemicals in their workplace. The following industries raise the risk of bladder cancer: dye, rubber, chemical. Other industries that may raise the risk of bladder cancer include metal, textile, leather. Other occupations that may raise the risk of bladder cancer include hairdressers, machinists, printers, painters, truck drivers. People who have had bladder cancer have an increased risk of getting the disease again. People with other types of cancer who have been treated with certain drugs may be at increased risk of bladder cancer. Also, people with other types of cancer who have had radiation therapy to the abdomen or pelvis may be at increased risk. Arsenic is a poison that increases the risk of bladder cancer. High levels of arsenic may be found in drinking water in some areas of the world. Not everybody who has risk factors for bladder cancer develops bladder cancer. Some people who have no risk factors for bladder cancer can still develop the cancer. Symptoms. Common symptoms of bladder cancer are finding blood in your urine, which may make the urine look rusty or darker red, feeling an urgent need to empty your bladder, having to empty your bladder more often than you used to. Symptoms of bladder cancer also include feeling the need to empty your bladder without results, needing to strain or bear down when you empty your bladder, feeling pain when you empty your bladder. These symptoms may not be caused by bladder cancer. Make sure to see a healthcare provider to find out what is causing your symptoms. Diagnosis. If you have symptoms of bladder cancer, your healthcare provider will try to find out if bladder cancer is the cause of your symptoms or if there is another cause. You may have a physical exam and additional tests. Your urine may be tested by the lab. The lab checks your urine for blood, cancer cells, and other signs of disease. A cystoscopy is another possible test your healthcare provider may use in diagnosing bladder symptoms. During a cystoscopy, your healthcare provider uses a thin, lighted tube called a cystoscope to look directly into your bladder. Your healthcare provider can remove samples of tissue with the cystoscope. This is called a biopsy. A pathologist examines the tissue under a microscope to see if it is cancerous or not. In most cases, a biopsy is the only sure way to tell if cancer is present. If cancer cells are found, the pathologist will examine them and decide what grade they are. The grade of the tumor describes how abnormal the cells look as well as how fast the tumor is likely to grow and spread. The grade describes how advanced the cancerous tumor is. Tumors with higher grades tend to grow faster than those with lower grades. They are also more likely to spread. Healthcare providers use tumor grade along with other factors to suggest treatment options. Staging. If you have bladder cancer, your healthcare provider will determine the stage of the cancer. Staging is an attempt to find out if the cancer has spread, and if so, to which parts of the body. Stages are usually described using the numbers 1 through 4. A lower number indicates an earlier stage. Staging is helpful in deciding the best course of treatment. When staging bladder cancer, healthcare providers want to find out whether the tumor has invaded the muscle layer of the bladder, whether the tumor has invaded nearby tissues, whether the cancer has spread, and if so, to what parts of the body. Blood tests may be one way that healthcare providers determine the stage of bladder cancer. Blood tests can show how well the liver and kidneys are working. A chest X-ray may also be used to determine the stage of bladder cancer. IVP stands for intravenous pyelography. During this procedure, a dye that shows up on X-rays is injected into your blood vessel. The dye collects in your urine, which makes the bladder and the rest of the urinary tract show up on X-rays. Tumors can show up on a CT scan. An MRI is also used to make detailed pictures of areas inside your body. It uses strong magnets to create images of the inside of the body. You may receive contrast material by injection to make abnormal areas easier to see. Another test that may be done to determine the stage of bladder cancer is an ultrasound. Sound waves are used to create pictures that show the organs and tissues in the body, including your bladder. The picture can show a tumor or blockage in the urinary tract. Treatment and supportive care. After diagnosis, Healthcare providers recommend treatment based on the following: the location of the tumor in the bladder, the grade of the tumor, the stage of bladder cancer, the general health of the patient. There are several options for treating bladder cancer. These include surgery, chemotherapy, biological therapy, and radiation therapy. The healthcare provider will recommend some combination of these treatments. Surgery is an option for most people with bladder cancer. The surgeon may remove part of the bladder or the whole bladder. Surrounding tissue may also be removed. You and your surgeon can talk about which type of surgery may be right for you. Another treatment for bladder cancer is chemotherapy. Chemotherapy uses drugs to kill cancer cells. You may receive chemotherapy into the bladder, by mouth, or into a vein. People with early bladder cancer may receive a treatment called biological therapy that helps keep cancer from coming back. This can help boost your body's natural defenses to kill cancer cells. Radiation therapy uses high-energy radiation rays to kill cancer cells and stop them from growing and spreading. There may be clinical trials available for people with bladder cancer in your area. In clinical trials, healthcare providers test new medical approaches and treatments. Bladder cancer and its treatment can lead to other health problems. It is important to control pain and other health problems before, during, and after cancer treatment. This is known as supportive care. Supportive care treats and controls pain and other symptoms. It also helps to relieve the side effects of therapy and helps you cope with emotions.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Bladder cancer is a common type of cancer. The exact causes of bladder cancer cannot be known, but we know in general what factors cause cancer. Smoking is the biggest risk factor for developing bladder cancer. The main signs of bladder cancer are blood in your urine, a constant urge to empty your bladder, or difficulty in urination. These signs can be the symptoms of other diseases. There are a variety of treatments for bladder cancer. The treatment depends on the location of the cancer, its stage, its grade, as well as the health of the patient. Treatment includes surgery, chemotherapy, biological therapy, and radiation therapy. Make sure to talk to your healthcare provider if you have any questions or concerns. Bladder cancer is highly curable if found and treated early. Thank you for using Explain.